Hello, good afternoon. Today we are going to see the case note of Miss Betsie. And today the letter is written to Miss Stella Howard, the head nurse for Woodside Nursing House in Norwich, 142 Woodside Road, Norwich, where the patient will return after discharge. So, from the writing task, it is very clear that we are writing to a person who knows about the condition of the patient, because it's clearly said that the patient will return after discharge. So it's clear that this patient is a resident of Woodside Nursing House, Norwich. So this is for the basic information, basic vital information, what we have to keep in mind. So when we select the data from the case, it should be very clear that we have to select the very relevant things instead of selecting everything, because the letter is not that much big. It's not too much confusing actually, but we have to be very careful in selecting the important information which is relevant to a person who knows the patient before. So let us go to the letter in detail. Now we can see this is an 89-year-old patient whose name is Mrs. Betsie Anderson. Now we have some information here: allergy to iodine, flushing rash. So the patient is known to the carer, so it's not relevant. Lives in Woodside House Nursing Home facility, so it doesn't matter because we are writing to the same facility. We have to write this address anywhere in the front. Now we have the basic medical background. All these things are important, but this basic information is known by the recipient of this letter. Now let's move further. That is the recent history. Now this is something from where we have to start seriously with. So the recent history is that she has low-grade fever. She lost 6 pounds in 1 week, new onset of incontinence, increased somnolence, patient confused, oriented to person only. Because of these reasons, the patient is being transferred to your care. So the patient is an aged person. The patient is confused, oriented to person only, increased somnolence, new onset of urinary incontinence, loss of 6 pounds in 1 week, low-grade fever. These are the recent history, and that is the main reason why the patient was sent to you for the treatment or further investigation and treatment. So she was admitted on the February 16th. And we have the record. See here, we have a record here. That's vitals here. We have these things. We have these things. Now, we have a lot of, we have the urine blood culture pending. So the report has to come. So urine analysis with the presence of bacteria. So lab report confirmed that she has urinary tract infection. So the first thing that we need to update to the previous carer is that the patient has got urinary tract infection. This is the vital information they want to know. For what is the real condition of the patient right now? The seriously, she has got some presence of bacteria. That's urine analysis confirmed it. So she has got infection here. So now the patient blood culture and urine culture is sent, and it will be coming later. That the lab report has to be collected, and they are to be reviewed later, because you have the patient is getting discharged on 19th. So just in 3 to 4 days that she is getting discharged. So the blood culture and urine culture will be coming later. So we have not yet received the blood and urine culture results. But we have confirmed that she has infection. That's the rise in the white blood cell count. Urine analysis shows that the patient has the presence of bacteria in her urine. Now we have the nursing care. So what is relevant? So we have assess the level of consciousness, BP, assisted with daily activities. These are all the things you have done. Frequent toileting with proper hygiene, assist with increased activity, starting PT. So this becomes a question. Most of the students tend to write these things because, so these are something which we have given at the hospital. So they think that this has to be written. Okay, if you write, no problem. No problem. But the thing is that we are going to update the health status of this. We have done something. We done daily assessment, including level of consciousness, BP. So whether we need to continue it after discharge, it becomes relevant. We assisted with the activities of daily living. So is it needed after discharge is the question. Now we have frequent toileting with proper hygiene. So this is needed after discharge. So what are the things that we have to consider after discharge? This has to be kept in mind. Now, one more thing that we have to see, that we found that patient has orthostatic blood pressure, that is orthostatic hypotension, and transition during position changes only. So this is something very important here. Now, this becomes important. Why? Because it was not mentioned earlier in the medical history. So we have to say that the patient, because we found it's something which we have to inform the carer, other than the problems with urinary tract infection. So this is an additional information. We have found that patient has urinary tract infection, and we have started some medications, and we have given some we have some plans and all. In addition, that we have something that is orthostatic hypotension, and now the patient is no longer confused, and she's oriented. So something, patient is oriented. So we have discharge medications here. Now we have written we have to write all this discharge medications. Now you may ask the question that levothyroxine is a medication which was going before. Why this medicine has to be written later as under the heading discharge medication? The reason why we are writing is that This comes under the heading discharge medication. They might have sometimes a dosage change in the medication. We might not know whether there has been there was any change in the dosage of the medication or something like that. So what exactly was the previous dosage? It was not written. So we are not sure the dosage of the previous dosage earlier. So what we are going to write is the discharge medication as a whole, like levothyroxine, cholase, protonix, ciprofloxacin, multivitamin with calcium at night, so these are the medications we should go after discharge. So we simply write these are the discharge medication and list it down, including the dosage and the frequency. That's it. So it becomes important because it is important for the carer, because you are going to give information about the discharge medication, which has to be continued after discharge. So what about the discharge plan? It has everything is important here now. The discharge plan here for follow-up with GP Dr. Alex Rose. Repeat urinalysis and labs in 2 weeks. Continue daily vitals and assessment. Observe signs of dehydration and orthostatus. All these things are important. It has to be done. Now, the patient needs walker, cane, and bedside come out. This is because of patient is at risk of incontinence, and she may have frequent toileting, and she has to get assisted with her activities of daily living. She needs assistance in walking too. So these are the requirements what she has in the Betsie Anderson. Now we have our letter here. So let us see. Miss Stella Howard, that's the person to whom we are writing to. Now, dear Miss Howard, reference Miss Betsie Anderson, aged 89. I'm writing this letter to update the current health status of Miss Betsie Anderson, who recently sought a treatment for urinary tract infection from our facility. So it is very clear that for what Miss Betsie Anderson came, it's because she had a new onset of urinary incontinence. We confirmed it as urinary tract infection. So she has undergone treatment for urinary tract infection. It's very clear in the purpose paragraph itself. So no confusion there. She is discharged back to your care today. So the date. Now, if you go further on Miss Anderson's admission on this 16th, she underwent a series of investigations which confirmed the aforementioned diagnosis. What was the aforementioned diagnosis? Is urinary tract infection. So blood investigations were the urine analysis were done, vitals were analyzed. So from all this, we have confirmed that she has urinary tract infection. And in response, she was given tablet acetaminophen 650 mg and was commenced on intravenous ciprofloxacin. So this was the immediate response in the hospital. So these two medications are these were the preliminary medications, the first medications which were given after confirming her diagnosis. At our care, she was found to have orthostatic hypotension, which was altering with slow position changes. You might have confusion whether she had orthostatic hypotension before or not. That is a question here still. But we have given the phrase at our care because it was not mentioned earlier. At our care, she was found to have orthostatic hypotension. So in this case note, it is given orthostatic BP. Orthostatic BP in the sense it is orthostatic hypotension. So we made it very clear which was altering, means modifying or transitioning with slow position changes. We changed some words there. We made it a little bit simpler. So in order to make, but still the words are formal. We have not selected any informal words there. We have selected very formal words which are understanding to a reader. Ms. Anderson's discharge medications are the following. So I told you that discharge medications or all are there in the list. You just write it. That's it. Use appropriate comma, punctuations and all at the correct places. That's it. So you may have some confusions where to capitalize things or not, where we have the trade names, we capitalize, where we have the generic names, we just don't capitalize. So that's what we normally do. So now here, I don't have this capital here, multivitamin and calcium. Okay. We have all the list of these medications, and she is now oriented and ready for discharge. However, she requires a walker, a cane, and a bedside cupboard. Now, why we have written this thing here is that this all comes under the heading discharge. So we have categorized or we have organized in discharge. So she's ready for discharge. She's oriented. She's less confused, but she needs a walker, a cane, and a bedside cupboard after discharge. So there is another confusion whether this has to be provided by the hospital or this has to be provided by the carer. We don't have any information here. So we just has written because equipments required, it's written under the heading equipment required. So normally a question arises, so whether it has to be given by the hospital or whether it has to be given by the carer. We have no information whether who has to give it. It has to be given by the carer or it has to be given by the hospital. So we simply has written it, she requests. Well, that's the reason why we have not written that under, that's the request paragraph. We would have written in the paragraph below, if we have confirmation that it has to be provided by the carer who is responsible for the discharge care of Miss Betsie Anderson. So that's the reason why we have written it's under the discharge paragraph. We are not, because it all comes under the heading discharge. Now we have the requirement paragraph at last. It would be appreciated if you could continue assessing Mrs. Anderson's vitals, blood pressure, and level of consciousness. So all these things you were assessing and you have to continue doing. So this, we were doing it at our care because of the alterations, because we found the alterations in blood pressure. We have found alterations in level of consciousness. At the time of admission, she was less confused. She was confused. And she was oriented to person only. It means the level of consciousness was assessed earlier because recent medical history was very clearly written. The patient was oriented to person only. It means level of consciousness was assessed earlier. And the information is there in the case note that level of consciousness and BP vitals were assessed. Yes, we have done that. So it has to be continued. after discharge too, along with blood pressure, because she has orthostatic hypotension. So that is the first thing that we have written, the requirement paragraph. Please be aware that she is at a risk of dehydration and orthostatic blood pressure. So this is something which we have to write, because we need to update. We need to focus these things. And she has a follow-up with Dr. Alex Rose. Why I have not written it is the GP, it is because they might know that who is Dr. Alex Rose. So the name of doctor is given there, so we have selected the name instead of the position, that's GP. With her urine analysis and laboratory reports in just 2 weeks. And if you have any further queries, please do not hesitate to contact me, yours sincerely, nurse. We have the address of the hospital in the middle, that is Norfolk and Norwich University Hospital. You can find in the middle of the case note. I'll show you somewhere. Yeah, hospital information, Norfolk and Norwich University Hospital. So that is the end of the explanation. Hope you might have all understood. Thank you once all. Hope to see you soon with another letter. Thank you.